Hello class, this is Pei Zhang. This is our second presentation for this course, and we will be covering relationships among texts in written communication. Written texts in any communicative situation can be interrelated in three basic ways: referential, functional, and generic. As we will see, these relationships are often of relevance to the medical translator. Referential intertextuality. Directly or indirectly, medical texts, and indeed all texts, contain references and information from other texts. For example, a textbook on a university course contains information that comes from well-established sources of medical knowledge, such as treatises, encyclopedias, as well as from research papers and revision articles that contribute to updating medical knowledge. This is called referential intertextuality, and it can best be seen in direct citations and bibliographic references. Functional intertextuality. Different texts dealing with the same topic may have different functions. In the example above, a university textbook may contain information from a given set of research articles, but it is used for a different purpose, to support the teaching and learning process of future health professionals. Other genres fulfill other functions. An editorial on smoking and heart diseases in a research journal critically comments on one or several original articles on that subject. A leading original article on breast cancer and a specific drug may give rise to a summary for patients, or a newspaper article on that same topic, but with different functions. We will call this textual relationship between texts functional intertextuality. Functional intertextuality underlies the fact that genres are dependent on each other as far as communication is concerned, because each of them covers specific needs of writers and readers. We will go over a few hierarchies of medical genres. We find that questions that have theoretical or clinical relevance lead to hypotheses or research articles, which leads to assessments and editorials and many textual genres, which also leads to applications to practice, handbooks, and clinical textbooks. This, in fact, also leads to distribution outside the profession, such as popular guidebooks. And these also lead back to questions having theoretical or clinical references. Generic intertextuality. Different texts dealing with different topics may carry out exactly the same function and share the same formal features. For instance, an editorial in any medical journal, regardless of the topic it deals with, comment on the research contained in other articles, tries to provoke critical discussion, and typically has no fixed section and subsection headings. Likewise, any patient information leaflet, regardless of the particular medicinal product, is used to guide the patient as how to take the medicine. This type of relationship among texts that share the same function and the same formal characteristics is called generic intertextuality.